Hello, my name is Charmaine Shepherd. I'm a functional medicine practitioner, and today I wanted to talk to you a little bit more about cardiovascular and cardiometabolic risk. So this is a topic that's quite close to my heart because very often what I find is that a lot of my patients will come in saying, there's a genetic predisposition in my family. My mum had cardiovascular disease, my dad, my cousins, my uncles, everybody in the family. And so there's often a lot of fear about it. And yet, when we come to look at how risk is quantified, very often it takes a first incident before patients are even given access to things like carotid artery scans. So with cardiometabolic and cardiovascular health being so amenable to lifestyle change, it's always encouraging to be able to say to people that, even if you have genetics of cardiovascular disease in your family, that does not mean that you will go on to develop cardiovascular health. It does mean that you are more likely to develop these conditions under certain health conditions, but there's so much you can do to reduce your risk. And I think it's really important in terms of not just lifespan, extending people's lives, but health span as well. If you think of the impact that having a stroke, for instance, can have on long-term health, a lot of these things can be prevented. A lot of these things can be, you can really end up extending your life in a very healthy way just by making some small changes. And that's what I really want to bring across today, is that there is a great deal that people can do, even if they have genetic risk. So I'm going to jump right in and talk about cholesterol because it is considered the main risk factor for cardiovascular disease. And cholesterol has been villainized throughout the years as being one of the major drivers of cardiovascular disease. And yet, as cholesterol levels are being pushed lower and lower with the use of statins, we find that mortality from cardiovascular disease has not reduced much. Ironically, low cholesterol has been implicated in the development of some strokes. You see, cholesterol is the building block of both your stress and sex hormones. So an increase in cholesterol is the body's way of adapting to its environment. So if the body is more inflamed or more stressed, the body will naturally begin to increase cholesterol. So it makes sense then to, rather than just try and push cholesterol down, to start looking at the underlying drivers of why your body is pushing up and creating more cholesterol. We know that statistics show that 40% of people who've had heart attacks had a cholesterol level below 5, which is considered optimal. And although cholesterol lowering medications, your statins, do bring down cholesterol on paper, they don't always prevent heart attacks. So statins are thought to reduce the risk of mortality by only 30%. But that means 70% of people on statins are still at risk of having an event. So there is a big place for statins. I'm not saying people shouldn't take them, but what I am saying is we should also be looking at what's happening underneath and what's driving that cholesterol up, and dealing with all the things that are at play underneath as well, not just relying on statins to do the whole job. In fact, a lot of people can't tolerate statins because of the side effects, muscle pains, liver issues, brain problems as well. And if you think about it, nearly 70% of the brain is made up of fats and cholesterol. So it's not a surprise that when we do a lot of cholesterol lowering, that people do end up struggling with brain issues as well. And ironically, in postmenopausal women, statins do increase the risk of strokes. So, they have a role, they can be really important, but I think it's really critical that people also look at all the things they can do underneath to make sure that the body isn't in that position where it's trying to produce a large amount of cholesterol. So if I could bring just one key concept across in my talk today, is that our vascular system is not isolated. You know, our medical system has created a very reductionist approach whereby we separate out our body systems, cardiology, gastroenterology, immunology. But what I really would like to explain today is that the vascular health is a complete ecosystem. I want you to think about blood vessels as being a broader indicator of health. And later on, when we talk about carotid scanning, ultrasound scanning, we'll look at the blood vessels' health. We can actually see the culmination of many factors impacting on those blood vessels. And of course, as blood vessels feed the entire body and all your organ systems, any damage inside these vessels will translate to damage in organ systems as well. So often people will say to me, you know, I have a family history or I have a carotid scan result showing thickening. What supplement should I take? But there are so many contributing factors that will be contributing to, you know, a vascular process. And finding out what's at the root cause of it is absolutely essential. So that way you know where to put your focus and your energy. So today we'll just be thinking of the blood vessels in your cardiovascular system, your whole body as an ecosystem. And we'll be looking at, you know, what it is that keeps your blood vessels healthy and all the elements that could be impacting on this very fragile ecosystem. So I always think when it comes to, you know, cardiovascular disease developing, the formula looks something like this. There is definitely a genetic element, but it's a combination of genetics plus environmental factors, plus our lifestyle choices that then go on to make some changes in our metabolic system that will lead to cardiovascular disease. So we need to really look at cardiovascular disease in a much more complex way. There's never just a single factor at play, and often you'll find it's a combination of bad cholesterol and inflammation and blood pressure and metabolic syndrome. And in fact, inflammatory markers are better predictors of cardiovascular disease than cholesterol alone. So this is a functional medicine panel looking at cardiometabolic health. What you'll notice is that it does test also your traditional markers like cholesterol, total cholesterol and triglycerides, which is often measured by, you know, as standard by your GP. But I want you to take note of the additional markers that are there. Your very low density cholesterol, oxidized LDL, LPA. I'm not going to go through all of this because this is just a very quick talk. But we look at a much longer list than traditionally is used to look at cardiovascular disease. And I think it's really important because you want to look at as many really important markers to get an idea of maybe where your risk is or where things might be going wrong. So this is a really good diagram of looking at how plaque is formed within our arteries. You can see a normal artery on the left-hand side and then progressively building up some endothelial dysfunction all the way through to unstable plaque formation. But plaque doesn't just build up because of cholesterol. It does build up as a result of a whole lot of, you know, factors that affect that endothelial lining and inflammation as well. So, you know, looking at all the reasons why the body may be forming plaques is really important. And this is how functional medicine really looks at cardiometabolic disease. This is a diagram from the Institute of Functional Medicine. And you'll notice that it's not just blood pressure and cholesterol here. On the left, family history is there, infection, dysbiosis, toxic exposures, high levels of insulin, oxidative stress. All these things can drive a process within the cardiovascular system. And you'll notice that at the bottom, modifiable personal lifestyle factors, these are all factors that have got really good research and backing behind them, showing that you can actually alter some of these to have an impact on heart health as well. But there are lots of things that can contribute to a process within the heart, all the way through from what's happening in your gut to chronic infections and autoimmune disease, and looking at things like your insulin levels, thyroid function. And so all of these things do have to be taken into consideration to have a really good idea of why you may be prone to developing issues in this system. And as this is a short talk, I'm not going to go into too many factors, but there are a few really interesting things that we can see now, that your gut microbiome, as well as fat cells themselves, can have a really big impact on development of not just cardiovascular disease, but diabetes and metabolic syndrome as well. We need to look at a lot of things that are in a lot more broader way. So it becomes important to identify and address anything that might be contributing to affecting heart health, inflammation, oxidative stress. Insulin dysfunction is probably the biggest driver of cardiovascular disease, and yet it's very rarely tested in clinic, and it's a very inexpensive test to run as well. But an increase in the hormone insulin can drive up blood pressure and cholesterol. It can trigger clotting and markedly worsen the outcomes of cardiovascular disease. So we know for people with high insulin levels, lifestyle change can be extremely powerful in reducing this cardiovascular process. If we start to think about what is driving cardiometabolic health, we need to look at lots of different areas. We need to look at insulin, blood pressure, maybe things like sleep apnea, not just your lipids, but also, cholesterol levels. Things like, is your thyroid working well? What's your vascular health like? What's your cortisol levels like, your stress hormone, homocysteine, testosterone, lots of really important ones. And actually, even things like gum disease have been closely connected with the development of cardiovascular disease. Lifestyle is exceptionally important when it comes to vascular health. I think we're all aware that smoking massively damages our vascular system. But what are some of the other important areas to look at? What are some of the other investigations you should look at if you have, either you found a thickening in your carotid artery, or some of your other blood markers are showing a higher level of cardiovascular health. And of course, there are so many things here that can be dealt with lifestyle medicine. And so, when we start to treat, we kind of break up where the key areas are that somebody is struggling with. So for instance, if the issue is mainly around vascular health, there's pretty good evidence that things like magnesium and potassium, taurine, pomegranate, lycopene, garlic can make a difference. If the issues are more around coagulation or blood clotting, things like bromelain or vitamin B6, nattokinase, vitamin E. So it is really important to, there's no one size fits all for looking at what's happening in terms of cardiometabolic health. So I believe that everybody over the age of 40 should be getting a carotid scan every year or two to have a look at the health of their arteries. So your carotid ultrasounds are a very powerful diagnostic tool for looking at atherosclerosis. So looking at whether the arteries are maybe hardening or narrowing and limiting the flow of blood, and of course increasing the risk of heart attacks and strokes. What makes your CMT scans very valuable in functional medicine is its ability to provide a very early warning system for cardiovascular health. And it's so easy to do. It takes 5 minutes. It's non-invasive, a really, really simple scan to do. One of the things about carotid scans is that we take the person's results and we map it onto an age related graph as well. So you can get a good idea of where you are in terms of how your vascular system is aging. So, you know, whether you're on track or whether you're maybe aging a little faster than you should be. And of course, there's always a lot you can do to reverse some of these changes. So again, from a functional medicine point of view, we really start looking at the underlying causes sitting underneath the surface, and not just the conventional focus. So not just your cholesterol and blood pressure, but really digging a little bit deeper to really identify risk factors. And just again, a functional medicine panel will be looking at, you know, markers like plaque activity, homocysteine, inflammatory markers. So really a much bigger picture than we normally would simply see in a cholesterol panel. We do see a shift happening in medicine. It's a little slower, but you can see these guidelines that have been put out by the American Heart Association and the American College of Cardiology. So the updated guidelines reinforce the importance of healthy living, lifestyle modification and prevention, building on a shift that happened in their recommendations in 2013. To looking at identifying risks earlier on and preventing rather than waiting for a first incident to happen. And I'm not going to go into too much details, but you know, even looking at mechanisms like stress that can drive that process of hardening and narrowing of your blood vessels. Stress, there's a mechanism by which stress has an impact on, you know, affecting the nervous system, but even bone loss, bone density, damaging that endothelial lining, inflammation, blood pressure, everything. So, you know, there are lots of things that you can do lifestyle-wise, but it's really important, again, try and understand where your specific drivers are coming from. This is a really important one. In 2016, the HACE advisory reported that there is a substantial body of data associating sedentary behavior with the risk of developing diabetes and cardiovascular disease and overall mortality. You can reduce your risk for having a heart attack by 50% purely with exercise. So, you know, of course, there's a lot of really important markers to look at. But there's so much one can do in terms of lifestyle and nutrition. Most of you will be well aware of the Mediterranean diet, which is just a collection of dietary habits followed by people, you know, living in the Mediterranean area. Diet involved with high olive oil, vegetable, legume consumption, fruits, nuts, spices, herbs, moderate fish and poultry, low red meat and dairy, and low to moderate alcohol. And we do know that the Mediterranean diet has got quite a lot of research behind it in terms of preventing cardiovascular disease. But there is, you know, there's a lot more, I would say, really in-depth research that's out there on a lot of different food types. So there's been so much research on the Mediterranean diet, and yes, you read that right. Over 4 million subjects in the Mediterranean diet and health status study. So big study, but really showed a 2-point increase in adherence to a Mediterranean diet. Showed an 8% reduction in overall mortality, 10% reduced risk of cardiovascular disease, 4% reduction of neoplastic disease. So we can see that lots of really good benefits for the Mediterranean diet. And again, very limited on time today, but lots of really interesting information on sulforaphane, which is a sulfur-containing compound, which can be found in certain cruciferous vegetables, broccoli, watercress, cabbage, Brussels sprouts. And we know that the benefit of sulforaphane is because it's a very powerful antioxidant, very powerful anti-inflammatory as well. And we do see that in animal studies, it has been able to lower your total cholesterol and triglyceride levels as well. So the cardiometabolic food plan has been designed by the Institute of Functional Medicine, and it's a very well researched food plan that has been shown to have really remarkable effects on cardiometabolic markers. I really like these. I run a lot of blood testing, and we often put people onto the cardiometabolic diet and then retest, and you can really see quite a big difference. So it's a low glycemic, low anti-inflammatory diet, lots of phytonutrients. It keeps your insulin levels low and inflammation low as well. And it does often translate into much better blood work as well. So, I've got so many patient cases whereby we personalize a plan for them, and you just see those changes in the blood work, which is great. You know that they're going on a different trajectory in terms of their health risk.
So if you've been told that your triglycerides are high, these are the sticky cholesterol units. We know that omega-3 fatty acids from fish and sulforaphane, which is in cruciferous vegetables, have got some really good evidence for bringing down triglycerides. Having said that, we tend to find as your insulin levels go up, your triglycerides are also going up. So managing insulin becomes really important when triglyceride levels are high.
So what we've done here at Edinburgh Health is to create a 6-week health heart program, which has been incredibly successful. And we've had, many of our participants really change their blood work. They're able to get changes in their ultrasound results as well. And it's a really lovely program, research-based program that takes you on a 6 weeks journey. And in this journey, what we really look at is explore everybody's individual drivers, because we do some blood testing, we do some ultrasound scans as well, work out what each person's individual drivers are, whether it's, what's driving this process for you. Is it inflammation? Is it insulin? And then work out, specifically where people need to put their focus and attention. And also there's a journey of coaching people through what they need to do, so they know exactly what they need to do, and then to get measurable results. But a very, very exciting program. And so our team here is really excited to have put together a fantastic program. We have nutritional therapists, we have herbal medicine, functional medicine practitioners, health coaches. That's all come together to design a really, really wonderful program. And we always believe what you nurture grows. So, investing in your health and investing in that longevity and health span can really, help you grow the kind of health that you want. So we very much hope to welcome you onto our program.